طيب صباح الخير جميعا. العافية. اليوم محاضرة الانفكشوال صح؟ نبدأ فيها الصبح والمساء اندوكراين. اوكي. طيب خليني اعطيكم الميديسين من ما طيب اللي بالخلف شباب سامعيني كويس؟ Can you hear me well guys؟ تمام. Alright. First of all, regarding first lecture, I think number of the students contacted me maybe a couple of days ago regarding the slides, the first lecture slides. Okay, it's already there, like on the section number 2, your live section. Okay, موجود يعني سلايدات موجودة اللي هي أول محاضرة. Okay. The last part of the first lecture going to be like self-reading, as I mentioned. If we get time, if you have any questions, just let me know. Second thing, Dr. Mia already gave for her students first quiz, or quiz, active learning, out of 5 points. It was maybe yesterday. So this Wednesday, inshallah, we will have our active learning quiz, okay? Out of 5 points. ماشي? Out of 5 points. حاول تساعدوا يعني it's like more like assignment rather than يعني open book quiz, okay? موضوع معين. البنسلين article the same عشان to be on the same page with the other section, okay? Inshallah. But absolutely it's gonna be different type of questions, okay? So you have to go through it, get in details, okay? Then hopefully you can answer the questions. ماشي؟ طيب. This Wednesday يوم الأربعاء هذا اللي هو the second lecture حتكون this week. ماشي؟ Clear؟ واضح؟ okay? طيب اليوم أول 5 أول 10 آخر 5 الله أعلم. Okay? أو يعني it's gonna be Wednesday during your lecture. Okay? Doesn't matter whether it's in the beginning or toward the end. طيب ها؟ يعني ما انتوا already قاعدين جو باك يعني عن جد تمسحوا. ما انتوا شوفوا يعني ما شاء الله قاعدين مع بعض يعني انت شايف اللي هناك عادي. بالتالي ما في جوبات كل واحد يحل لحاله. Okay? You have to have the article with you guys, like hard copy, to be able to answer. Okay? Okay, so print it out. ماشي print it out and bring it with you. Okay? واضح؟ يعني مش ما في استعارة للارتكل، والله اعطيني الارتكل الحين مش عليه حاجة. واضح؟ واضح يا شباب؟ تمام. So first exam, I think the date is not يعني posted yet, huh? نزل متى؟ ما هو واحد نزل. Up to my knowledge يعني إنه yesterday it was not available. Maybe today, maybe this week. I'm not sure, but it should be released soon, because the beginning of the first exams should be November 5th. Okay, November 5th. أول امتحان. The امتحانات first for the whole university. So it might be November 5th or after. Okay, so we will see. Okay, topics for the first exam will be the introductory lecture, antimicrobial selection, plus the upper respiratory tract infection. We will cover it, and we will cover this week. The lower respiratory tract infection topic we will cover it inshallah next week. And maybe I will give one خلينا نقول pre-recorded lecture, okay? In case يعني إذا كان الوقت ضيق وخصوصا في آخر محاضرة. ماشي؟ عشان to cover the whole first exam material before next Saturday. صح؟ Not this Saturday. The coming Saturday will be the beginning of first exam timeline. ماشي؟ طيب. Upper respiratory tract infection, we will cover mainly otitis media, and pharyngitis. Okay, pharyngitis and otitis media. So we will start with otitis media, and we will leave the second topic for this coming Wednesday. Okay, right. First of all, طبعا I PDF of the slides. I think you have all the slides on the all section. Okay, already Dr. Mia Mishkura طبعا. She already post all the material online. Acute otitis media. First of all, what do you mean by acute otitis media? Otitis طبعا كلمة أوتو أو أوت طبعا أوت mean ear, okay? Ot mean ear, otitis mean inflammation. So we have inflammation in the ear, but which part? Media, middle ear, okay? يعني الكلمة جاية من وين؟ أصل الكلمة اللي هو otitis media من ear infection or inflammation in the middle ear region specifically. Do you know like ear anatomy? We have external ear, we have middle, and we have internal ear. صح؟ حدا بيقدر يقول الاكسترنال منين جاي؟ أي يعني شو حدودها؟ What is like anatomy for the external؟ خليني أرجع هذا الفيجر. شوي. Zoom in. Okay, can you all you see? Okay. طبعا هذا هاي فينا اللي خلينا نقول اللي هي شو شحمة الأذن أو يعني الأذن الخارجية شو بنسميها؟ سوان. Okay, in Arabic whatever. Okay, so you have the canal here, auditory canal, guys. Okay, till you reach the tympanic membrane here. Alright, اللي هو دوم خلينا نقول tympanic membrane. Alright, عندنا في عندنا الأوسيكلز اللي هي يعني 3 bones here. They conduct okay any sound to the internal ear. Then it will be translated by the cochlea. Cochlea طبعا هي قوقعة الإذن. Cochlea. Then to the nerve system, and this is how you get like translation for any sound you hear. As simple as that. The external ear, جيد, it does extend from here till where? خلينا نقول طبلة, till the eardrum. So this region here is the external ear. Okay, external ear, and we have infection for the external ear, by the way. But what we care about today, اللي هي ايش؟ focus, our focus اللي هي on middle ear. The middle ear, which part? It's gonna be from here, يعني after the eardrum أو tympanic membrane, okay, involving ايش؟ eustachian أو eustachian عم بيسموه eustachian tube اللي هو it does connect the middle ear to what? Nasopharynx. لجوا للحلق يعني هو بيربط الأذن وين؟ من الجوا. بالتالي that's why we have physician okay specialized in ENT, ear, nose ايش؟ ear ونوز وشو؟ the throat صح؟ اللي هو أنف وأذن وحنجرة because all the system connected to each other. واضح؟ clear? So the middle ear behind the tympanic membrane, let's say, eustachian tube involved in the middle ear infection أو middle ear diseases. الكوشليا أو الكوكليا عفوا ما بيسموا في ناس بيسموها زمان كانوا يلفظوها كوشليا هي كوكليا أوكي اللي هي القوقعة. It does involve أو it's already within the internal ear space. ماشي؟ أوكي؟ معروف الاناتومي external internal middle ear. Then behind the tympanic membrane involve the ossicles, these bones, as well as the eustachian tube. Eustachian tube, it does connect the middle ear area to what? Nasopharynx area. So this what will tell us? Will tell us that if you have, for example, especially in pediatric patients, خلينا نقول أطفال, they suffer most of the otitis media, أو ear infection, middle ear infection, okay? Because they have a connection. All we have eustachian tube, right? You have the eustachian tube, I have it. الطفل عنده, okay? But we have differences in the anatomy. As we will see in the يعني إن شاء الله next slides. Okay? So any infection in the throat, it might reach where? خلينا نقول or nasopharynx, it might reach the middle ear. So maybe we will get some sort of infection in this area. So swelling, edematous, صح? Okay, you have a swelling, edema, bacterial infection, viral infection, whatever. This will start accumulating fluids here, صح? وبالتالي, how we check that this guy or this girl, whatever, like this kid, having اللي هي middle ear infection, by otoscopy, we look to from the external side to the tympanic membrane, and if we will see redness, bulging, for example, that will tell us that this patient is suffering of what? Middle ear infection. Sometimes the patient will come with perforated tympanic membrane. Perforated tympanic membrane, ليش? Why? Because the infection actually here, it might get accumulated and make like some sort of a pressure on the tympanic membrane, and get it perforated and start getting like خلينا نقول liquid وبus. Okay, كل هاي الفلويد discharges from the external canal. صح؟ عمر حدا التهبت اذنه وصارت تخرج يعني زي نوع من الصديد او سوائل. ممكن في ناس تعرضت لها even for adult it could happen. لكن it's most common when otitis media في pediatric patient, pediatric population. Why? Anybody can tell why pediatrics they suffer most of the خلينا نقول otitis media infection rather than adult? I will hear from both of you. We can start with your colleague here. وين؟ في البيدياتريك؟ Shorter, yes, correct. But it's more like horizontal shape. It's more like horizontal shape في البيدياتريك. Okay? في الادلت it gets more angled. Okay? وبالتالي it's not easy. The infection can pass through this canal and cause the otitis media infection, but it could happen in adult. Okay? So, but pediatric more common because as she mentioned that it's shorter, قصيرة, this gestation tube, as well as it is more like horizontal shape, and this will lead to more incidence of infection in the middle ear. تفضل. The perforation sometimes reversible. Should be the tympanic membrane should be healed after the infection got like vanished. لكن sometimes actually the tympanic membrane, if the perforation was like wide enough, maybe they need like some sort of surgery. Okay? يعني ممكن تضلها مخزوقة الطاقة. لكن in pediatric population, I'll tell you something and you can tell the answer. Pediatric, they, according to the statistics, also almost majority of pediatric like the subject, they get like otitis media in the first 3 years of their life. Okay? Or tell most of them. So if everyone will, the tympanic membrane will stay like perforated, that's mean what? That nobody will hear. لكن this will guide us أو خلينا نقول move us to say إنه if you notice that this children or this خلينا نقول kid is having like learning disabilities, okay, difficulty in development, hearing issues, okay, he cannot for example, or she cannot خلينا نقول تتعلم بسهولة النطق, okay, this will tell you that he or she might have issue with the ear. Okay, you need to check. Maybe the nerve itself, the cochlea, ممكن تكون مشكلة problem with the cochlea or with the auditory canal اللي هي mechanical process اللي هي the voice conduction system اللي هي through the tympanic membrane. Okay, I don't need to go deep in anatomy, okay, or pathophysiology, but the most important part is we need to know what is the middle ear. It does involve the after the tympanic membrane. Eustachian tube involved in this process, and this is where you get the sort of infection from. Okay, the eustachian tube. Okay, واضح؟ طيب خلينا طبعا according to statistics, let's go back. طبعا we have as I mentioned, it's the most frequent diagnosis in infants, children, the first 3 years of their life. Year 1, 50% of children, they get at least one episode. Age 2, 60%. age 3, 30%. So that's tell us that for children who are like less than 2 years old, they could receive what we call Streptococcus pneumonia vaccine. Streptococcus pneumonia vaccine and influenza. Okay? We will talk about vaccine in the coming slides. ماشي؟ يعني most important critical period to get otitis media متى يا شباب؟ اللي هو up to 3 years. It will be less common with time. Less common with time. Okay? The sign of symptoms for the middle ear infection in children. يعني, 2 years old doesn't speak, right? Maybe he can say some words here and there. But how you can tell he or she might having like otitis media? انت وصفي لي طفل عمرك شفت طفل؟ تفضل. يعني بضله يعمل ear tugging هيك يسحبها لانه حاس his ear is hurting, like he has like pain here, right? شو كمان fever ممكن because it's like infection. What else? Irritability, doesn't feel well, so يعني he's not happy, keep crying. Okay, that means he's struggling with something, he's suffering with something, he's not happy. Okay, what else? We can check through the otoscope, send him to a physician. He can check the tympanic membrane and see whether he has infection or not. Okay, it's very straightforward diagnosis. Just look at the tympanic membrane. The physician can differentiate between normal and inflamed, for example, otitis middle ear. Okay? طيب. We have recurrent acute otitis media. What does that mean? That it happened for the first time. Okay, then after a while, like a couple of months or 3 months, he got the same problem again and again. Why? Because sometimes you have what we call remnant after, like for example, the otitis media get dissolved, خلينا نقول get treated, for example. The patient might still have like some sort of a fluids inside the tympanic membrane area after the tympanic, in the middle ear region. And this is full of bacteria, okay? And the bacteria might go again and again and cause the same problem more time. Okay? واضح؟ تمام؟ حدا فاهم؟ حدا مش فاهم؟ طبعا most common pathogens very important. Why? Streptococcus pneumonia, up to 40% of the cases, bacterial infection. Haemophilus influenza, okay? And by the way, our children here, according to National Vaccination Program, they receive Haemophilus influenza vaccination. Okay, الأطفال بأخذوه عندنا في الأردن. Okay? طبعا, we got lots of improvement على مستوى on the vaccination level in Jordan, so Haemophilus influenza was included also in the national vaccination program. تفضل. بالسامعك. هو المفروض يغطي كل الستينز الموست كومن في الاوتيتس ميديا. اوكي يعني احنا بنتوقع فور اكزامبل هيموفيلس انفلونزا serotype 1, 2, 3, 4 example. Okay, we will take just like part of them associated most commonly with causing like otitis media. Okay, so المفروض انه نغطي. الماركزيلا تتراليس up to 20%, Staph aureus, the Streptococcus pyogenes, E. coli, sometimes viral infection. Okay, so viral infection could lead to what? Otitis media. Okay, sometimes you have like you start with viral infection, okay, and you get secondary bacterial infection, and sometimes also they already have like primary bacterial infection as the sort of infection for otitis media. Okay, Streptococcus pneumonia is very common. يعني ممكن توصل فيه in other countries up to 50%. Good number, right? صح؟ وبالتالي children or pediatric patient, they are they're supposed to get what we call pneumococcal vaccine if they are less than 2 years old. ماشي؟ طبعا مش موجودة في المطعم الأردني. We don't have it for the national vaccination program here in Jordan. As well as what other vaccine the pediatric population they can take, like influenza vaccine. Influenza vaccine, but age not less than 6 months, 6-month-year old. يعني ما بصير you can't give influenza vaccine for kids who are less than 6-month-year old. Okay? من ال6 شهور طالع ممكن تعطي الانفلونزا فاكسين متى؟ yearly يعني كل سنة. Even for adult, anybody is taking like influenza vaccine on a regular basis. Okay? When they're supposed to take it? October, right? Beginning of the خلينا نقول نهاية الأوتومن, the end of autumn till early spring اللي هو April. You can take it anytime during this period. Okay? But better to take it during like October because, you know, this is the flu season will be in the coming months. Cold weather, so more chance to get infected with the influenza virus. Okay? As well as Streptococcus pneumonia. Streptococcus pneumonia is a bacteria, and we will talk about the vaccine in the coming slide. طبعا, you need to write after me, guys, لأنه many things that I mentioned not exist in the slides. Okay? واضح؟ انتوا عندكم تسجيل وعندكم كتابة يعني ما في عندكم you don't have any argument or excuse عفوا later on during the exam. طيب عفوا sorry. حكينا عن eustachian tube if you remember. more angle في الادلت الانجل 10 degree يعني nothing صح؟ It's semi horizontal like 10 degree يعني nothing. وبالتالي it's easy okay to get the infection from the nasopharynx area. That's why pediatric population they used to have like more خلينا نقول otitis media infection. Risk factor for otitis media يا شباب طبعا هذا according to if they have allergies, the allergic patients they might develop more like otitis media. Anatomical defects, cleft palate يعني هون مشكلة بالupper palate اللي هو الشف الأنابية بسموه صح؟ عارفين شو الشف الأنابية؟ تشوه خلقي، اوكي cleft palate. day care attendance إذا واحد عنده جيرد أو immune deficient جيرد what do we mean by جيرد؟ أخذتوا الجي آي؟ جاسترو شو الجيرد؟ gastroesophageal reflux disease واحد عنده always having symptoms of burning sensation. The acid will go up to the pharynx. Some people they wake up every day like having sensation of burning in their throat or hoarseness in their voice because of what? The acid goes up, okay, and it might lead to some sort of what? Infection as well, صح? Lack of breastfeeding. Breastfeeding sometimes is very important because it is really helpful, okay, for the خلونا نقول babies' immunity and their health, of course. طبعا low socioeconomic status always connected to infectious disease. الميل sex طبعا إذا كان الجندر هنا boy أكثر من girl. Native طبعا American هذا according to their own statistics. The USA pacifier use. What do you mean by pacifier? إلا هاي إذا بتطلعوا على هاي طبعا في للأسف في شفت كثير بهالمول بتلاقي وقعت هاي على الأرض بتطولها ماشي طبعا يعني حرام يعني كأنه مسح الأرض الولد. طبعا في عادات أو بتلاقي بتحط له إياها مع عسل honey okay أو سكر just like the pacifier she dip it in sugar or honey okay to make like to let him taste something sweet and with time this will affect his teeth actually okay he might get like black اللي هو تسوس أسنان. طيب شايفين يعني حتى الباسيفاير علم عادي. طيب positive family history أو genetic predisposition للإنترايتس media. Tobacco smoke exposure could lead. Viral respiratory tract infection winter season حكينا الانفلونزا viruses. young age at first diagnosis. Hello. Young age at first diagnosis. That means he or she might have also recurrent otitis media with time. Clinical presentation, as we mentioned, ear pain, irritability, tug on the involved ear. يعني ممكن تكون هاي الأذن ملتهبة أو هاي الأذن ملتهبة بصير يحك فيها بصير يشد فيها tugging. Okay. Difficulty sleeping, fever. Bulging eardrum, as we mentioned, this you can't see unless you use the otoscope. صح؟ يعني you need to have some instrument to see through the auditory canal اللي هي من خلال الإذن. يعني لازم تشيك جوية الإذن شوفي. مظبوط؟ مالكم صافين فيني. جد بخاف أنا بس أصلا. Pneumatic otoscopy. طبعا sometimes we will talk about the tympanostomy. Tympanostomy, sometimes they put insert some tube, thin tube inside the tympanic membrane, try to get rid of the remnant fluid. Okay, then the patient will have no recurrent infection. This could help sometimes. Okay? طبعا it happened to me one time, I don't know why, back in years, when I was adult, by the way. And I got tympanic membrane perforation at that time. Okay, but I got some sort of treatment with antibiotics, and I think I'm doing fine. Okay. Fluid in the middle ear is symptomatic. Pathogen طبعا هاي with effusion. What do you mean by effusion? شباب. What do you mean by effusion? يعني you have a fluid accumulation behind the tympanic membrane. Sometimes it could be asymptomatic. Okay? Asymptomatic. يعني sorry. Patient is suffering of no pain. Okay, at this stage, but with time it could lead to some sort of the pain. Pathogen H. influenza, Streptococcus pneumoniae, same bacteria, bacteria involved in the otitis media by itself. And viral infection, of course, could lead to 50% of the cases. طبعا diagnosis, we covered يعني most of the symptoms and signs. Laboratory test, by the way, or further diagnosis, sometimes ما نوصلنا نقول بعدين من هو اللي بدأ السايكل كلها هاي. طيب sorry. لاحظوا انه for diagnosis sometimes the physician he might get خلينا نقول aspiration from the fluid, okay, and send it to the lab for culture عشان نشوف البكتيريا resistant, especially for recurrent cases. Especially in recurrent cases, we need to know more details because it seems that the antibiotic you gave or the first management you gave is not working well. Okay? طبعا في عندنا tympanometer. هسه حتشوفوا انه الطبيب مرات he could tell that whether the tympanic membrane actually is moving or not. If it is not moving easily, that means what? Rigid. معناته we have a fluid behind the tympanic membrane. Okay? Because tympanic membrane like the drum. Okay, it transfers the signal toward the internal ear, right? Through the ossicle, العظمات تاعت الأذن, or then after that to cochlea and the hearing nerve, etc. Okay, so tympanic membrane is very important. If get perforated, تلاحظ the tympanic membrane, it's very tiny inside your ear. It's very small, okay? But if somebody loses it, he couldn't hear anymore. So يقول لك مش سامع. صح؟ Also, sometimes if patient they have especially the adult, if they have infection inside the ear, like otitis media, they feel that the sound is coming imagine that you are under the water, okay? اللي بيسبح, those who swim. Actually, if you go underwater, imagine how the pressure there, and whether you can hear or not, okay? It will be the same. The fluid here, it's like the tympanic membrane, behind the tympanic membrane area, full of a fluid, اوكي مليانه سوائل، تجمع سوائل، بالتالي مش عماله بسمع الصوت جاي كانه هو تحت المي والناس بتحكي، يعني بتحرك شفايفها الناس وهو مش سامع، ممكن يكون لهي الدرجه من السوء. ماشي؟ طيب وممكن يصير عنده تينيتس، طنين بالاذن اذا الالتهاب كمان وصل للانترنال اير. اوكي sometimes patient they develop what we call tinnitus. ماشي؟ شو tinnitus بنقول عنها؟ what do we mean by that? we have اللي هي like ear ringing بسموها، يعني زي ماشي. طبعا middle ear infection by the way especially also في الادult sometimes you will have like problem with what? with the balance. So sometimes you feel dizzy, or if you put your example your head on the pillow you start feel some sort of spinning. صح؟ okay يعني هاي سيء شعور really bad feeling. okay طبعا not the only reason for spinning انه يكون عنده otitis media. sometimes they have something with the cochlear part او sometimes the bone of the ear. okay ممكن تعمل لي نوع من السبيننج او الديزنس، انه بس يجي ينام الشعور هذا بيمسك. طيب this is the normal eardrum. I think it should be more white by the way. okay الacute otitis media redness and bulging يعني بتظهر عندك we have some sort of bulging. okay with effusion you will see perforated eardrum and discharges as well as like redness. ماشي؟ طبعا you can tell by otoscope exam. طبعا هاي better clear picture. خلينا نشوف هاي النورمال، شايفين؟ لاحظوا ايه نورمال حلوه شكلها بين طبيعيه. هون في عندنا redness وبالجينج، هاي لسه اسوء الحاله. ماشي؟ نمبر دي اذا بتلاحظوا هاي بيكون البلجينج اسوء واسوء. ماشي؟ طبعا if we see like perforation here we can tell with the fluid discharge. بيكون اذنه سيء. طبعا sometimes they use you need to give like both oral as well as topical antibiotic in this case if you have severe infection or with the effusion. Physician they give like oral and ايش topical اللي هو inside the ear يعني antibiotics. طبعا هون في عندي bulging في erythema like you see like more clear blood vessels. okay here and this will tell you that he has a fluid for sure behind the tympanic membrane. otitis media واضحة. شو المانجمنت؟ طبعا if you hear about otalgia طبعا mean that pain in ear يعني ear pain. okay this is otalgia. acetaminophen ibuprofen ايش if he has fever and pain you can give acetaminophen because we talk about mostly like pediatric patient أكيد. ماشي acetaminophen ibuprofen could be given for pain management. some sort of home remedies يعني في ناس بصيروا يحطوا لك زيت sometimes hot oil or oily drops زي anesthetic local anesthetic inside the ear like some sort of anesthetic أو خلينا نقول to relieve the pain. this not helpful that much. في عنا we have tympanostomy. It does need really skill and in a clinic يعني by specialized physician اللي هو to insert like a tube inside the ear to get rid of the discharges behind the tympanic membrane and the patient should feel relieved very soon. طبعا first of all the management guys بتعتمد انه if you have a kid for example who is struggling of otitis media you can wait for up to 24 to 48 hours. okay if the symptoms خلينا نقول was not get better like you didn't see any improvement in the situation you could actually seek the antibacterial or antibiotic use. ماشي antibiotic use. And in general we give like high dose of amoxicillin. High dose of amoxicillin. شو بدنا يلا ليه نسولف عن الأبر. احنا كل ما نحكي عن توبيك يصير عندنا تسبتم سبعة. في واحد بيشاركنا. طبعا شباب باي ذا واي هون البريفنشن طبعا لاحظوا I want to mention one point. بس 11 الا ها الوقت الكويس بضيع بسرعه صح؟ طيب حكي عن الفاكسينيشن وحكي عن التريتمنت. طبعا في عندنا الفاكسينيشن ستريبتوكوكس نيومونيا فاكسين. في عندنا we have the conjugated we have polysaccharide. الconjugated we call it a Bervinar 7. زمان كان في 7 من اسمها 7 mean that we have 7 serotype of streptococcus pneumonia. Nowadays we have 13, we have 15. Bervinar 13 or 15. So 15 and 13 they already replaced the Bervinar 7. يعني الآن بطلنا بس نكتفي بسبعة. Okay, صرنا 13 و 15 for pediatric population. Why conjugated? Conjugated in general it's more more efficient. Why? For especially for if you are looking for prevention for a long time. And conjugated mean you have the polysaccharide, the capsule of the bacteria, as well as what antigenicity protein attached to the polysaccharide. So this will stimulate the immune system much better. Okay? Means that the prevention will go much longer. So we use it in pediatric population, and you will see we could use for elderly patient اللي هي برفنار بسموها برفنار. طبعا هي كل يوم ترجعوا على البيت تشوفوها 13 or 15. The 7 not in use anymore, but it was used before 2010. Okay, we have what we call PBS V23. هذيك لا, we have more serotype of streptococcal pneumonia, and it's just like polysaccharide vaccine. Polysaccharide vaccine is not that strong, okay, and that's why we use it in geriatric patients. Okay, طبعا هاي يعني it does need more details to explain the vaccination system, but you need to know that we give like streptococcal pneumonia vaccine. Nowadays we use the Bervinar 13 or Bervinar 15 or V20, V23. The Saliki 23, it's like only polysaccharide, not conjugated. You need to know what is the difference between conjugated vaccine or polysaccharide vaccine. Okay, واضح? As well as influenza vaccine, as I mentioned, you can start giving it at the age of 6 months for the pediatric patient, like every year. See some recommendation, like twice a year. We're gonna take it for twice a year. Good if we have it for at least annually. For example, I never talk like any influenza vaccine. Okay? Acute, chronic, otitis media with effusion, non-pharmacological, all management should be NSAIDs or paracetamol, ear drops with local anesthesia. Okay, if we have for sure confirmed bacterial infection, then we can go for antibiotics or antibacterial. Antibiotic selection depends on different خلينا نقول criteria. Antimicrobial susceptibility, whether we have penetration into the middle ear, the clinical efficacy, the cost, adherence, resistance pattern. So all these factors affect your selection for antibiotics. As I see, you can see, guys. Sorry. In general, you should give amoxicillin or amoxicillin clavulanic acid in high dose. طبعا you can see the regimen here, and if the patient is having, for example, penicillin allergy, then you can give like cephalosporin, for example, cefdinir, omnicef, اللي هو الجسم التجاري cefdinir. With those, as I mentioned earlier, we need to give like high dose of amoxicillin in 2 divided doses every day, and treatment duration actually it does affected by what? The type of infection, whether with effusion or without effusion, etc. Okay? تفضل. If you confirm that this is bacterial infection, كيف تعرفي؟ If you have a fever, for example, if the infection stays for more than 24 to 48 hours, يعني صار الموضوع انه طول معنا، اكيد you can start with antibacterial agents. Okay?
Doctor, the duration of treatment was affected by type of infection?
By type of infection, of course, and as we will see, like 10 days, 7 days, 5 days, we have slides explaining everything in the طيب. Sometimes we have, as I mentioned, this is initial. Either if you are using, for example, antibiotic and it didn't work also for like, you used it for like 48 hours, 72 hours, and you don't see any kind of benefit, you might actually facing resistance. So you might give like other options like amoxicillin with clavulanic acid. Clavulanic acid, why we give it? Beta-lactamase inhibition. So we're expecting that the bacteria is more resistant and having like beta-lactamase ability or capability inhibition. Okay, beta-lactamase inhibition. So you need to give beta-lactamase inhibitor. Okay, and in this case, the bacteria actually is releasing the beta-lactamase. It will break down the beta-lactamase, so you give beta-lactamase inhibitor. اللي هو شو اسمه؟ What is the name? Clavulanic acid. Okay? طبعا في عندنا clindamycin, ceftriaxone. You can give in this population like many options, as you can see in this table. This table is very important. Okay, you have to go through it. I tried to check the new guidelines. Actually, the new guidelines, whether they change the practice with time or not. Actually, till today, they are recommending amoxicillin or amoxicillin clavulanic acid. If you go to dentist, if you go like ENT, the first antibiotic will start prescribing for you, will initiate you on amoxicillin clavulanic acid, and many patients actually they are resistant to such therapy. تفضلي. بالنسبة للألرجي قلت لك في عندك اوبشن ثاني سيفدينير مثلا اللي هو cephalosporin, and even though we have some sort of precursory activity, but it's like up to 10%, so we expecting he should be fine. And depend on the allergy. If he has developed, for example, rash, خلينا نقول حساسية طبيعية من البنسلين, okay, you can even use amoxicillin itself. Okay, but anaphylactic shock, you have to think it twice, of course. Okay, you have to be like more خلينا نقول vigilant toward which antibiotic you are giving. وشيء يا شباب طبعا هنا في algorithm طبعا بقول لك متى تستخدم whether to give antibiotic ولا لا. الوجع قعد اكثر من 48 ساعه. هذا جواب على سؤالك. ركز معي. جواب على سؤالك انه فوق ال 48 ساعه الان بيعاني من شويه fever. He's suffering of fever. The pain is more than 48 hours. Okay, if yes, so then give antibiotic. Then you have to look for age, whether 6 months to 2 years, bilateral, acute, yes, antibiotic, or observation, etc. So you should just follow the algorithm and you should be fine. ماشي؟ طبعا duration العادة 10 to 14 days, لكن it's really a long period of time, صح? So we will face a problem with adherence. In this case, 5 days, they found that 5 days we might be effective, 5 to 7 days. ماشي؟ Maybe.
يعني دكتور في أدوية أنا بستخدمهم لمدة 10 ل 14.
هو زمان اللي هو ideal before it was 10 to 14. That but they did a clinical trial 5 days, 7 days. They were effective also. They were
نفس الدواء عادي.
Yeah.
نفس الجرعة ونفس.
Yep. Absolutely. يعني amoxicillin nowadays guys إذا بتروح على الصيدلية amoxicillin clavulanic acid اللي هو 1 gram for adult. It's just like 14 tablets inside, صح? What does that mean? 1 tablet twice daily for 7 days. يعني هو حاسب لك إياه. Sometimes other physicians they give it to 10, but to be frank, nobody's using 410. Nobody's using 414, 15. يعني انت اول يومين بس تطيب. Once you feel that you are getting better, you just leave it. Okay, but this is of course this was the reason behind why people are getting the bacteria is getting more strong and getting high level of resistance. طبعا short course in children less than 2 years. Children more than 6 years you can go up to 7 days. طبعا هون زي سؤالنا على زميلتكم قبل شوي. اوكي طبعا هاي تقرأوها طبعا. بس I will double check whether it is for 10 days or for 7 days, the first point. Okay, I will let you know. ماشي based on the new update. Based on the new update. طيب أظن إنه الموضوع لطيف يعني مش صعب. طبعا هاي كل الأدوية اليوجوال دوز الكومن سايد افكت الكومنتس. اوكي كليندا ما يصير من كل يوز. شو طبيتوا جاهزين؟ وين رايحين هسه؟ Where are you going guys؟ عندكم محاضرة على الواحدة. ماشي؟ خليكم معنا. سفدينيا أو بنسميه سفيوكسين اللي هو زنات بيسموه طبعا اسمه التجاري. السفيتراكسون هذا السفيتراكسون اي ام intramuscular. Sometimes you need to give ceftriaxone, even clindamycin. So all options could be used for otitis media, based on recommendation or whether they have penicillin allergy or not, etc. عمره less than his age less than 2 years, more than 2 years, etc. So patient characteristics as well as bacterial characteristics. واضح؟ طبعا once inshallah you go through the slides and read it more and more, you get better idea about the topic. You can't own طبعا, you just do it by yourself. طبعا vaccine, I need you to go deep, to study well for vaccine, especially streptococcus pneumonia vaccine. You need to know the advances, okay, because it's required for the exam. ماشي. If you face any problem in understanding any point, just let me know. I can send you guidelines, CDC, Central of Disease Control guidelines, how you, when to give, what to give, in which cases. ماشي؟ نشوفكم بمحاضرة الثيرويد الساعة 1. يعطيك العافية.